to Honorable Chief Minister, our truly visionary leader of Andhra Pradesh, who has been the inspiration behind this conference. For last 3 months, he has been asking about taking various views, giving the directions to the planning department, to the health department on this very important topic on the population management, which is very close to his heart. In our Chief Minister, we have a very visionary leader. Few have the vision, the clarity to see the future, and still few have the acumen to show the path to achieve that future. This is something we have witnessed in our early careers also in the combined Andhra Pradesh. Vision 2021, Honorable CM had given the call. At that time, sir, I recall, as a student, the 5th generation computers, we knew basic and forgotten very minimal things about it. But it was the vision of the Honorable Chief Minister at that time that he said that entire government functioning has to come on the e-office. And the result was that in Andhra Pradesh, we achieved e-office at least a decade before than the other states and in the country, in the whole country. While the other country, in the entire central level, e-office came in 2012. In Andhra, we were already doing it in 2002. Similar is the case with many other fields in the combined Andhra Pradesh, whether it is telecom policy, whether it is the PPP policy for road development, for the Shamshabad airport development, or the education policy. The generations who could take on to IT and who are leading the diaspora in the US is a witness to that acumen and that foresight. With that foresight, the government of Andhra Pradesh had embarked upon a population management policy in the 90s, which we saw the results very quickly. It is striking to note, that in a period of 2 to 3 decades, 20 to 30 years, the fertility rate was achieved, which is better than many of the Western countries. So we have at 1.5% fertility rate today. It was an overaction at that point of time. But the 21st century calls for a very different action points on the demographic profile. Honorable Chief Minister, in this session, when he started, like Vision 2020, he has given us Vision 2047, which is aligned with the Government of India, Viksit Bharat. Padi Sutralu ani cheppi, what should be the direction that for a healthy, wealthy and happy Andhra society and Telugus, what is the pathway the Honorable Chief Minister has shown us. But to achieve that, it is very important that population management policy, we strike the correct note and there is a correction that is required. Sir, with your inspiration, today we had a complete full day workshop on this topic. There were 2 knowledge sessions followed by 2 panel discussions. Sir. Experts from various walks of life have dealt with the concept in a holistic manner, where it is social aspect, the economic aspect, the political aspect, the other nuances and cultural aspect, also the current environmental issues which are impacting the population demographic also was discussed. The global practices in some countries and what has been the impact was also discussed. Some of the striking points which have come out of the deliberations today are listed here out. AP has been experiencing a fertility rate which is much less than the many European countries. High rates of C-sections, hysterectomy and female sterilization is one of the key concerns that faces us today. In fact, last session there was a very active and live discussion on the topic, where it was said that why should sterilization be so high and what are the policy changes that are required to address the issues. Similarly, in various sessions, the various social aspects, the economic aspects and also the impact on the labor workforce participation, the demographic aspects of the concept were discussed. So this deliberation, as inspired by you, was to take the key points. We are making a working paper has been prepared today, and basis today's discussion, we will be preparing a draft paper which will be put to the public domain for further discussion and consultation with the public in the month of April. And with that, we hope to come up with a very robust population policy, management policy, which will address some of the corrective measures that are required given the challenges that we are going to face in the coming years on this count, sir. With that, I thank the audience and all the participants who have made a successful contribution to the deliberations today. And I will request for a very short brief for each session by the various session panel leaders. Thank you, sir.
Thank you, sir. As we move forward, it is essential to reflect on the key insights and discussions from our sessions and panel discussions today. To provide us with a brief summary of the deliberations, we now request our esteemed session and panel moderators to share their key takeaways and reflections to the Honorable Chief Minister. We first request Dr. S. Irudayarajan, Founder, International Institute for Migration and Development and moderator for the first session on Shift in Demographic Trends, Understanding Causes and Impacts, Andhra Pradesh and India, to kindly share a brief summary of the discussions and key insights from the session to the Honorable Chief Minister.
Thank you very much, Honorable Chief Minister of Andhra Pradesh. When I came here from Kerala, I felt that you are thinking ahead of other states by at least by 10 years. At least by 10 years you are ahead of that. And when I left Kerala, somebody asked me, what is this conference about population management? Why Andhra is doing? I think all states in the country will take a lead in organizing a population management conference because demography is going to change the future of every state. I think you have taken a lead. I think all other states will follow it up. I am going to speak to you here basically on the session which we organized on demographic trends, causes, impact and challenges, which was collaborated by us, by myself and Poonam Mukherjee from Population Foundation of India, Dr. Santosh Malhotra from the Jawaharlal Nehru University. I am going to give you some 10 points for us to think more on this, particularly on demography. After the new state came in 2004, you were the Chief Minister of Andhra Pradesh. And still after that, we have no database to understand the real demography of Andhra Pradesh. We had no census. We had SRS up to 2020, NFHS in 2021, and we are using the projection which was made in 2019 for all the discussion we had. We have no real-time data on demography. No real-time data on demography of Andhra Pradesh. I think you have to start thinking about a real-time data. For example, the TFR, as per the recent survey, estimate as 1.5. But I believe that it will be close to 1.9 or even 2. So the TFR, what you have is currently an underestimated number. So this is something we have to relook at it. The second point which we would like to make here is that the IMR, as per the latest data, what we have for Andhra Pradesh is 24, compared to 6 in Kerala, 3 in Singapore. And that means Andhra Pradesh can design policies. It's like a pro-natalist policy to reduce the IMR so that we can save children who are born in Andhra Pradesh. They live beyond the, what is called the child and mortality, so that we can have some more children in our state. The third point, which is very, very important, is that infertility or the childlessness in all the states are increasing. It's also particular in Andhra Pradesh. Close to 10 to 15% couples in Andhra Pradesh have difficulty in having children. The state, especially the family planning department, should intervene and help them to have the ideal number of children they want to have. By this way, your TFR can be increased. TFR can be increased. I think we should, help the couples to have children. This is a new strategy for the family planning program. I think you should start from Andhra Pradesh. And the fourth one is very, very important. Today, 70% of the Andhra Pradesh married women are sterilized. Even we want to increase fertility, we are talking to only 30% women. I think time has come for us to talk about spacing methods so that couples want to reverse. They want to think of another child. They are already sterilized at the age of 23, 25. So we are not able to have some more children. I think we should talk about spacing methods. We should invest on the family planning program, especially on the spacing method. The fourth one, which is another point which is important, is that we are worried that the fertility decline in Andhra Pradesh will lead to what is called the labor crisis. I don't think we should worry too much on that. Your aim of transferring what is called the trillion economy, 2.4 trillion economy by 2047, I think it can be achieved through what we call them the India's demographic dividend. So India has a demographic dividend so that you can expect people from north to south to come in, like they are helping in Chennai, they are helping in Kerala, they will come in. I think you have to design user-friendly or what we call the migration-friendly policies in your state so that you attract people, give them proper labor right, give them proper wages so that your dream of achieving the economic growth by double digit can be achieved. The fifth one, we have no idea. The last few hours we are talking about fertility and mortality. Please remember, all of us we should remember, migration is also one of the component of population change. And we have no data on the story of internal and international migration from Andhra Pradesh. We have no story on that. And population management policy is not just fertility and mortality. We have to look at both internal and international migration. The sixth one, the first demographic dividend in Kerala, in Andhra Pradesh is almost getting over. But you have coming up with two important demographic dividend which is going to come for Andhra Pradesh. And you can tell the whole world, you can tell all the states in the country that look how we have achieved what I call them the second demographic dividend. We call them silver demographic dividend. People who are above 60, you can utilize the silver demographic dividend, you can make the elderly both engaging and empowering, and you can use them for your economic growth. Part 2 story of Andhra Pradesh. Demographic dividend to silver demographic dividend. I think that will have a long way to other states to teach them how they can utilize the silver demographic dividend. In addition to that, you also have a gender demographic dividend. You have a lot of women are not employed. If you can provide them gainful employment and opportunities, another dividend you can utilize and make the state to grow to double-digit growth. The next point, which is the eighth point, which is close to your heart, AP has a huge diaspora globally, not just in the United States. Globally, you have huge diaspora. You have to enhance them formally to development of Andhra Pradesh. I think that throughout the country, we are not able to utilize the diaspora for development. Diaspora comes when there is a crisis, like Kerala had floods, diaspora put money, but diaspora can be constantly engaged for the development of Andhra Pradesh in all aspects. I saw the first program, you are talking about 4. I think this is something you can bring it up, it will be having a long-lasting impact on the Andhra society. And also, we have to talk about bringing back the skilled migrants. Students go from Andhra Pradesh, but they are never returned, they stay in US. I think you should have, like China, think of a innovative return migrant policy to bring back what we call them brain gain. Bring them back. Remember the importance of Mahatma Gandhi in the India's development as a return migrant. If you can bring some return migrants who are big people in other countries, they will be your future leaders for the society. The last one, due to the decline in population, not just in your state, all the states in South India, we are affected by the financial transfer in the Finance Commission. I was sitting with the Finance Commission members. In Kerala, we are getting less money because we have less population. I think this is affected in all the states, including Andhra Pradesh. And we will also be affected by the delimitation exercise which will be coming in very soon. But we need to discuss it separately because that is not the population management policy. That is a separate discussion we should have on the delimitation impact on Andhra Pradesh and beyond other states. Because that is, we have managed well population. Now this is the impact. We should look at it separately. And finally, to conclude, I would like you should invest. Again, I say you should invest on assessing the current demographic scenario. What you have right now is some type of bits and pieces on fertility and mortality, and initiating a large-scale migration survey in Andhra Pradesh with the collaboration of the SRM University. I'll stop here. Thank you very much.
Thank you, sir. May we now request Dr. Niranjan Sagruti, Country Director, Population Council, to share a gist of the second session on global initiatives for population management to the Honorable Chief Minister.
Thank you so much, Honorable Chief Minister, Sri Chandrababu Naidu Garu sir, and to the esteemed dignitaries on the dais, my friends, my demographic friends, and also the large volume of the youth that I see, because that's where, first of all, let me start by saying that Nenu Kuda Telugu biddane sir. So, and I did all my post-graduation up to in Nagarjuna University, right in this city. So I'm so proud to be here, sir, to brief you on what happened in session 2, where we discussed about the global initiatives. There are 3 points that we discussed, sir. One, about the difference between how many children women want in Andhra Pradesh state and the actual family size, meaning how many children are they having. So what all the surveys are indicating, sir, is that the woman in Andhra Pradesh wants 2.1 children. So the gap that currently exists between the 2.1 versus 1.5 or 1.7, whatever my previous speaker spoke about on the number difference, has to do with how and what way the reproductive birth experiences that we are providing to women. The one incident that we took when we were comparing it with the global initiatives and how other countries have dealt with the low fertility, we did take the Andhra Pradesh context in mind for that comparison. And what is happening here, sir, that in Andhra Pradesh, the first birth, the Andhra Pradesh, for that matter, is very proud to have high institutional deliveries. That is more than 95%. Unfortunately or fortunately, about over 60% of the deliveries are happening in private sector. And unfortunately, 70% of those first-time deliveries are ending up in cesarean section. And the moment the women have the cesarean section, that's when the negative birth experience starts. And that's something that we need to do besides actually in order for the woman to actually realize the intended family size, sir. One more point, sir, which is connected to this, which my previous speaker actually spoke about, is the sterilization, that is 70%. The first birth, cesarean. Second birth, again cesarean. And during that period, the tripectomy is being offered, and then going into the hysterectomy. There are total 4 surgeries that the women are experiencing in her reproductive life. And that's something that has to change, sir, in order for providing that. And a lot of countries, when we looked at the evidence, what exists in terms of the evidence, the countries have adapted the midwifery-led care to give the comfort for the woman to have safe delivery and the positive delivery experience, which actually will promote and fill that gap that exists between 2.1 children that I want versus how many children that I'm ended up having. That was the first point that we discussed, sir. The second point actually we discussed was about the population, the youth population in Andhra, and which is connected to their workforce participation. The youth in Andhra are actually, their aspirations are related to looking for having that work and that economic security and that job and the economic security, because that is what is changing, the aspiration. That's what is changing the aspirations of the youth. And that youth, to have that economic security, we need to create, and sir, the policy has to provide ample scope and opportunity for the youth to have that confidence in the state, to have that job experiences. And that's when you can actually control the brain drain that is going out from Andhra to outside state or outside countries. Today we are very proud to have so many CEOs in whether it is in India or outside India companies who are from Telugu origin. But what we need to do is, what is that, how the policy can actually cover this element in order to retain the youth that exists, that 15 lakh youth population in the 15 to 19 year age group, their skilling and their education that's being given so that they continue to have and serve for Andhra. That's going to be the second point that we discussed. The third point that we discussed was more about how there are other multitude of reasons for fertility decline, because it's not a straightforward one or two reasons. There are multitude of reasons for fertility decline that exist in case of Andhra Pradesh, and how the countries, and my demographic friends and myself also have this argument that whether do we see half glass empty or half glass full. I'm a bit optimistic, sir. The kind of vision that you have for the state, I'm so fan of yours. So the kind of the optimism that we see is what I would see. And the countries that we always take the example of Japan, South Korea as an example, but they're not the best examples, because the examples that we need to take is where did it work and how did it work. In the countries like France, Vietnam had same policy, two-child family policy as the India, as the Andhra Pradesh, as the family planning program, more aggressive family planning program, actually has used a very specific strategy for reversing stabilizing and reversing the fertility. It's not about not having an increase is not a success, but even stabilizing the fertility is a great success that I would actually see from the evidence, sir. So what Vietnam has done was that besides having childcare support and providing the specific benefits to the couples and for having more number of children, it actually also has encouraged the cultural value of having and being together in part of a larger family that will actually help the country not to reduce the fertility anymore. And sir, Vietnam is one successful country which has consistently maintained its fertility for the past 20 years, even increased the fertility. So is the France, is a country which actually has, and there are beautiful examples. And the one thing that we also discussed was about the male engagement and gender equality, which I think you need to really talk about and be our youth leader to talk about the male involvement. Thank you so much.
Thank you very much, sir. We finally request Dr. Padma Paturi, Head of the Department of Gynecology and Obstetrics, Andhra Hospitals, Vijayawada, to share the highlights of the discussions on socio-economic impact vis-a-vis population management to the Honorable Chief Minister.
Honorable CM Sir, it's my privilege to be able to speak a few words regarding maternal health in this conference. And with regards to healthcare in Andhra Pradesh, it is quite evident that healthcare infrastructure is in place, but real challenge is in execution and delivering the quality of care. AP stands as fourth best for low maternal mortality, well below the nation's average. This we have achieved by our very high institutional deliveries, which is 97% of our deliveries happen in institutions, which is far higher than nation's average. And early pregnancy registration at primary health centers and Anganwadi centers. And in the registration in the first 12 weeks of pregnancy, over 85% of our women are registering. This means that they will have a very early assessment of the pregnancy, which is like to determine which is the high risk pregnancy and how many antenatal visits they should have and what antenatal care they should receive and which cases have to be referred, etc. And also we have a very good maternity benefit system, and our ambulance services, the maternal emergency care services have been very good, and the use of technology, to say the least. Still there is scope for improvising this, and a detailed discussion is beyond this the timeline. So the three important areas I would say is to improve maternal nutrition. Maternal nutrition in the sense of not just providing iron tablets and folic acid tablets, it's to give them a diet chart, it's to get our dietitians or senior professionals to go and speak to the pregnant women in the community and to screen for anemia, and half of our pregnant women are anemic. With the maternal mortality of so low, we're not doing that great with maternal anemia, and anemia in pregnancy is a very, very easy area to, and it's not expensive at all. It's just the consistency of our ANMs, midwives, Anganwadi workers and ASHA workers to be giving away these iron tablets, and also checking on the compliance. Compliance is less than 50%, I note. We don't have the numbers for this, we don't have the data for this, but when we have unbooked cases present to us with hemoglobin of 4 grams in labor, bleeding, then those are all unbooked cases, and they have been given iron tablets but they have not taken them. So, and the next thing is training our ASHA workers, ANMs and midwives, regular training and retraining them. And if I may talk about my 2 decades of experience in UK, even when we were senior consultants, it was mandatory for us to go to the community, to the primary care, and train the midwifery care, the staff and also midwives there. So it's just making sure that they have got enough information and knowledge, and checking the data and then auditing the data and making sure that at the grassroots level, it's really the policies are working and they're happening. As I said before, infrastructure is great, it's there, it's just the execution. And going straight into the low fertility rate, my previous speakers have already briefed about that, but I would like to address the need regarding the infertility. Incidence of infertility in the books, in the papers, although it says 4%, 8%, 12%, but in practice, in Vijayawada and around, we are seeing like at least 20% of women are presenting with some fertility issues, and Andhra Pradesh is on high in the charts for this. And then the need to reduce the cesarean section rate, again the repetition of the topic. Cesarean section, we have to audit, and we have government is already doing that. It's along with the maternal deaths, we have to audit the raised cesarean section rate. Private sector, public government hospitals, both of them should be, the obstetricians should be made accountable for every cesarean section they perform, because once a cesarean, always a cesarean was once said, and now, and we have moved away from that. Once a cesarean, we can try for a vaginal delivery, but then if I may say, mostly in some of the private sectors, there's repeated cesarean section, and a woman can safely have only 2 cesarean sections. except in the exceptional situations. So, and regarding the sterilization, I've never ever, unless in a very rare situation in UK, I've never done a tubectomy during cesarean. Here, I came to India 10 years ago, and every second cesarean, they would ask us about tubectomy. By the way, Chesayochga, Panay Potandaga, and I have been talking in a lot of IMA talks and everything, saying that no, do not tie those tubes at the time of cesarean section, because how do you know that the baby is well? How do you know that the baby will fare well in 2 years' time? Why can't you simply wait and just give them time? And what happens in a very unfortunate situation, if the couple lose a child and they come to us, at least 1 or 2 cases in a week, they come to me to reverse the sterilization because they have lost a child, or the child is autistic, or has got some autoimmune disorder or some genetic disorders. So, discourage tubectomy during cesarean sections, and we can collect this data and audit this data. We can ask the hospitals, along with our maternal death calls that we get, that we need to maintain a register, and also cesarean sections. If we can audit the number of sterilizations that are being done along with cesarean sections, then if not for a good reason, then those can be stopped. Also, cesarean hysterectomies. Cesarean hysterectomy might be a life-saving procedure, so one cannot comment on that without taking into consideration that particular case. Next, we have a healthy mother, then we have a healthy child, a healthy neonate, healthy infant, a healthy child, and a healthy society. We must promote breastfeeding, and then going straight into how do we encourage, having my psychology cap on, how do we encourage and convince our younger generation to plan pregnancy at an appropriate age, which is like in their 20s or early 30s, without delaying? And it is a very sensitive issue. We are dealing with very educated and well-informed women here, couples here, and they have the financial freedom, and they would think it's their personal choice. I deal with these young couples all the time, like my daughter's friends and all. They come to me saying that they do not want children just because they don't want the responsibility, but they put it in a very nice way. So, focus on sharing information to them. Do not preach. They concerns first, like personal freedom and financial joy of parenthood. Give examples. Quote positive role models who have chosen parenthood without compromising the freedom. Address their concerns like overpopulation. Give them statistics, and say to them, this will work really well. Say to them, there are increased risk of complications in pregnancy if they get pregnant at 35. They come to me asking for, ma'am, can we freeze our eggs? We can have a baby at 45. So the answer is, we have to tell them, the medical professionals, us, and also as a society, the later you're pregnant, advanced age pregnancy will have may have higher genetic abnormalities. At the age of, I hope I'm not taking too much time, at the age of 20, the risk of chromosomal problems is 1 in 2000. At 30, it is 1 in 1000. At 40, it is 1 in 100. Drastically increased chromosomal abnormality rate, higher miscarriage rate, higher stillbirth rate, higher preterm babies, low birth weight babies, and increased risk of hypertension and diabetes complicating pregnancy, and increased cesarean section rate. The last point, if it's not inappropriate, I would like to bring in my experience in Europe. what it is, we are certainly not lagging behind in advanced medical treatments or surgeries, but there is a gap at community level delivering the quality of care. We do have enough manpower. We have more midwives and A&Ms than in UK. Like I would say, at least 3 times more manpower. It's the execution at the grassroots level and training the medical personnel, retraining them, auditing their work and looking at the data. This is the way forward, I would think, and getting the specialists to brief the medical birth attendants at the community level, and private doctors, and not just the government doctors. We are all happy to help. Our Honorable CM Sir had Vision 2020 that has been most successful, and now he has launched Vision 2047 stating people as an asset. People as an asset. Sir, we will all want to be part of your vision, sir. Thank you very much.
Thank you, ma'am. We now invite our Honorable Chancellor, Dr. T.R. Parivendra sir, to address the gathering.
Honorable High-Tech CM of Andhra Pradesh, dignitaries on the dais, invitees, participants, and dear students. Today, our CM or your CM was invited to lay foundation of new buildings in this campus. He readily agreed. He did his job. Along with him, I also joined. I thought I am going to be seated in the front row. Somehow you asked me to go along with him, sit on the dais. I asked him, should I speak? Yes. Having come to dais, you have to speak. See here, incidentally, today's topic of your conference is very simple. Any common man